This is the Emotional Vocabulary series by Duenas. Today we will address the difference between habit, addiction, and dependence. In the complex landscape of human behavior, certain actions and routines become so deeply ingrained that they shape our daily lives, influencing everything from our productivity to our well-being. Some of these behaviors, like brushing our teeth or exercising regularly, develop into beneficial habits that enhance our health and efficiency. However, when behaviors escalate beyond mere routine and become compulsions or physical necessities, they enter the realm of addiction and dependence, which are conditions that can have profound consequences on an individual's physical, mental, and emotional well-being. But where do we draw the line between an innocent habit and a destructive addiction? How does dependence differ from addiction, and what role does tolerance and withdrawal play in distinguishing them? Understanding these distinctions is essential not only for those struggling with behavioral or substance-related issues but also for society as a whole, as misinterpretation of these terms can lead to stigma, ineffective treatments, and misunderstanding. In this exploration of habit, addiction, and dependence, we will dissect their clinical definitions, analyze the progression from one stage to another, and discuss effective treatment approaches that pave the way to recovery. Understanding the difference between habit, addiction, and dependence. The terms habit, addiction, and dependence are often used interchangeably in everyday conversation, but in clinical settings, they refer to distinct concepts with different implications for treatment and outcomes. Understanding the differences between these terms is crucial not only for individuals dealing with these issues but also for healthcare professionals working to diagnose and treat them. This essay will explore the clinical definitions of habit, addiction, and dependence, examine their progression from one to another, provide examples of substances commonly associated with each, and discuss the best treatments available for each condition. Habit. The foundation of repetition. A habit is defined as a repetitive behavior that becomes automatic over time due to regular engagement. Habits can be positive, like exercising regularly or eating a healthy diet, or negative, such as procrastination or excessive screen time. Clinically, habits are not considered pathological or harmful. They are simply routine behaviors that a person performs with little conscious thought. The key to a habit is that it is typically not driven by a physical or psychological need, but rather by repetition and environmental cues. For example, someone might develop the habit of drinking coffee every morning. While the act of drinking coffee becomes routine and automatic, it is not driven by a dependency on caffeine, nor is it associated with withdrawal symptoms or an inability to control the behavior. It is simply an established pattern that the individual may or may not choose to continue. Treatment for habit. Since habits are not inherently harmful, they generally don't require clinical intervention unless they are leading to negative outcomes. If a habit becomes detrimental, e.g. excessive consumption of junk food, behavioral strategies like habit reversal techniques, mindfulness, or cognitive behavioral therapy, CBT, can help replace the habit with healthier alternatives. Addiction. A pathological relationship with behavior or substance. Addiction, in contrast, is a more severe condition that involves a psychological and often physical compulsion to engage in a behavior or consume a substance. The clinical definition of addiction emphasizes compulsivity and a loss of control. In addiction, an individual continues the behavior despite negative consequences and feels an overwhelming need to engage in it. Unlike habits, addiction typically involves significant distress and functional impairment, affecting an individual's ability to perform daily activities, maintain relationships, or achieve personal goals. Addiction can be both behavioral, for example, gambling addiction, or substance-based, like drug addiction. Substances commonly associated with addiction include alcohol, cocaine, heroin, and prescription opioids. The hallmark of addiction is the persistent craving for the substance or behavior, the inability to reduce consumption despite repeated attempts, and the escalation of usage to achieve the same effects. Progression. Addiction typically progresses over time. Initially, a person may start using a substance for recreational purposes or to cope with stress or emotional discomfort. Over time, however, the behavior or substance use becomes more frequent, and the individual may begin to lose control. Cravings intensify, and the person may neglect responsibilities and relationships. In severe cases, addiction leads to a significant disruption of the person's life and health. Treatment for addiction. Addiction is generally treated with a combination of therapies aimed at breaking the compulsive cycle. The most effective treatments include cognitive behavioral therapy, CBT. CBT helps individuals recognize and change harmful thought patterns that fuel addictive behaviors. Motivational interviewing, MI. MI is a client-centered approach designed to enhance motivation and commitment to change. Medications. For substance use disorders, medications like methadone for opioid addiction, disulfiram for alcohol addiction, or buprenorphine for opioid dependence may be prescribed to help manage cravings and withdrawal symptoms. 12-step programs. Groups like Alcoholics Anonymous, AA, or Narcotics Anonymous, NA, offer peer support and structured recovery programs. Dependence. The body's adaptation to a substance. Dependence refers to a physical and/or psychological reliance on a substance, where the body adapts to the substance in such a way that it becomes necessary for normal functioning. Clinical dependence is characterized by two primary elements. Tolerance, the need to consume increasing amounts of a substance to achieve the desired effect. Withdrawal, physical or psychological symptoms that occur when the substance is reduced or discontinued. Dependence can occur with both legal, like alcohol, nicotine, prescription painkillers, and illegal substances, like heroin, methamphetamine. A person with substance dependence may experience cravings and may go to great lengths to obtain the substance, but they often maintain the ability to control their use. While dependence can evolve into addiction, it does not always. Progression. Dependence typically develops after prolonged or repeated use of a substance. Over time, the body becomes accustomed to the presence of the substance, and without it, the individual may experience withdrawal symptoms. However, unlike addiction, a dependent individual may be able to stop using the substance when necessary, although withdrawal symptoms may make cessation difficult. Treatment for dependence. Treatment for dependence often focuses on helping individuals manage withdrawal symptoms and develop strategies to reduce or eliminate substance use. Key treatment options include detoxification, medical supervision to safely manage withdrawal symptoms, particularly for substances like alcohol, benzodiazepines, or opioids. Pharmacotherapy, medications like benzodiazepines for alcohol withdrawal or methadone for opioid dependence can help manage symptoms and ease the transition to sobriety. Behavioral therapy, CBT and other forms of therapy can help individuals address the root causes of their dependence and develop healthier coping mechanisms. Key symptoms and how to determine which is which. Habit. The individual has a repeated behavior, but there is no compulsion or negative consequences associated with it. The behavior can be stopped without significant distress. Addiction. The person continues the behavior or substance use despite negative consequences. There is compulsive engagement, and the person may feel unable to stop or control the behavior despite repeated efforts. Dependence. The person requires the substance to function normally and experiences tolerance and withdrawal symptoms. Unlike addiction, there may still be some degree of control over the substance use, but cessation can result in discomfort or distress.
Conclusion. Understanding the differences between habit, addiction, and dependence is essential for both individuals and healthcare professionals in addressing problematic behaviors or substance use. While habits are neutral and often harmless, addiction and dependence involve significant challenges that can disrupt an individual's life. Addiction is marked by compulsivity and loss of control, while dependence primarily involves physiological adaptation to a substance. Treatment approaches vary depending on the severity of the issue, with addiction requiring more intensive interventions like therapy, support groups, and possibly medications, while dependence can often be managed through detoxification and behavioral therapy. By recognizing the signs and understanding the distinctions between these conditions, individuals can take the necessary steps toward recovery and a healthier, more balanced life. Furthermore, the distinctions between habit, addiction, and dependence are more than just semantic. They define the nature of a person's relationship with a behavior or substance and inform the best strategies for intervention and treatment. While habits are ingrained behaviors that can be modified with conscious effort, addiction represents a loss of control and compulsivity that often leads to destructive consequences. Dependence, on the other hand, highlights the body's physiological adaptation to a substance, marked by tolerance and withdrawal symptoms. Recognizing where a behavior or substance use falls on this spectrum is crucial for determining the most effective course of action. Whether addressing a simple habit change, breaking free from the chains of addiction, or managing the withdrawal symptoms of dependence, the path to recovery requires a combination of self-awareness, medical support, and psychological intervention. By fostering a deeper understanding of these conditions, individuals can make informed choices about their health, seek appropriate help, and ultimately reclaim their autonomy and well-being. This was The Difference Between Habit, Addiction, and Dependence, from the Emotional Vocabulary series, by Duenas.